Okay, let's talk a little bit about how anxiety disorders are diagnosed. If you come across a website that, has you answer a bunch of questions and will tell you whether you have an anxiety disorder or depression, don't pay too much attention to it because that's really not how we diagnose disorders. The way that we diagnose any kind of psychological condition is through what's called a thorough diagnostic interview. These are structured interviews that take somewhere between 2 and 3 hours to administer, and they have to be administered by somebody who has specific training in how to do it. The people who are qualified to assign diagnoses are clinical psychologists, either PhDs or PsyDs, or medical doctors in the form of psychiatrists. Even just a general practitioner is probably not doing a 3-hour interview with you to see whether you meet the criteria for any particular disorder. So you really should go to somebody who's doing a very thorough interview. And the two most common interviews for diagnosing anxiety disorders are the SCID and the ATIS. The SCID is the Structured Clinical Interview for the DSM, and the ATIS is the Anxiety Disorders Interview Schedule. These are two fantastic interviews that are very, very thorough. And what we do is ask the patient a variety of questions. They're pretty long interviews, but it's not just, ask these questions and then fill something out and it'll tell you whether the person is depressed or anxious. Really, it requires a lot of deep thinking to establish something called differential diagnosis. And differential diagnosis is basically trying to rule out other possible disorders that might better explain the person's symptoms, or other possible conditions like medical conditions that might better explain the person's symptoms. This is not a simple process. It requires a lot of pretty careful thought, and you really do have to be very skilled to assign a good diagnosis. Now, the one thing that I want to say is whether you technically meet the diagnostic criteria for a disorder or not doesn't have that much bearing on what treatment will look like. So, for example, if somebody comes to me for treatment and they suffer from some really bad panic attacks, and I do the ATIS or the SCID interview, and I see that they don't actually meet the threshold, they don't meet all of the diagnostic criteria that are necessary for a diagnosis of panic disorder, I can still treat them, and I'm going to treat them using the exact same interventions and skills that I would for somebody who did have full-blown panic disorder. So what I want you to know is, number one, whether you meet the criteria for a disorder or not doesn't have any impact on the fact that you are struggling and you're suffering and you deserve help and you qualify for help. And number two, whether you meet the diagnostic criteria or not doesn't necessarily very deeply affect how we would treat you using really good cognitive behavior therapy. So certainly it's worth knowing whether you meet criteria, but it's not the most important thing in the world when people are seeking help.